back. You're watching Know Your Health. Of course, I'm your host, Sylvia Nyongesa, and with me in studio, I have Mr. Jacob Wawire, who is a clinical officer in charge of God's Favor Nursing Home, and he's here to answer all your questions about malaria. Of course, if you have any other questions, you can still send them on our Facebook page at Imani Television or on our SMS line that will be passing through your screen. Now, before we went for that short break, we were discussing about the people or the groups which are at risk of contracting malaria, and we have just the doctor had just told us about the extremities of age, which include infants and of course people of old age who of course their immune system is a bit low. And we were also discussing about patients who have other underlying conditions. Now we'll just be back with our discussion, of course, and maybe you can continue to tell us about these groups that are at risk of contracting malaria.
Okay, we set into another group which are at risk of getting malaria. We had a tackle about a pregnant woman. This is a sensitive group, and it will also emerge in our treatment because they also get a different treatment. They are not treated as the other group. So for pregnant women, this is because there is change in that hormones. So they are prone for that parasitemia. Then there's also other organs which are developed, such as the placenta, which is we call it in a layman language the womb. So with such development of the organs, they lower the immunity. So such groups, they get prone to that infection. Then the next group, these are people who are traveling from one area to another. One area to another in this sense, meaning that a patient or someone is traveling to an area of endemicity. An area of endemicity meaning that that area is the one prone to those infections. Like when someone travels from Nairobi to the lake region like Kisumu. So such travels also, or rather such groups, they are prone to that infection. And we will also discuss in our treatment on how we can prevent the malaria, or rather the malaria or the parasites in such groups.
Maybe if I can just ask, what makes it different for that person traveling to an endemic region? What makes it more prone for them to get malaria as compared to the person actually staying in that region?
Okay, there's actually no difference in such groups. The only difference is that with the travelers, this is a person traveling from an area where this parasite cannot thrive. So he's going in an area where the parasites are thriving. So for this person, he has just that susceptibility of getting the infection. It doesn't go by say that maybe the person living in such an area might not get the infection, and the one traveling to that site might get. So the only difference is that you are traveling to a place where there is endemicity, there's those parasites, and there's also a chance whereby you can travel and not acquire the infection. So that's the difference.
Maybe we could just talk about transmission and the factors of malaria.
Okay, for malaria, the transmission is, as I alluded earlier, is only transmitted by a female Anopheles mosquito, an uninfected female Anopheles mosquito. So we cannot be able to distinguish in everyday to-day life. We got mosquito bites, but we cannot be able to differentiate if this is a female Anopheles or not. So for the transmission, it's only transmitted by an infected female Anopheles mosquito. Have ever come across this village notion that someone was just traveling, or rather he was caught up in some rains, then the next day he or she starts saying that have developed malaria? No, that's not the essence. The essence behind this is you only get malaria after being bitten. Then we have factors whereby within our household, within our area of jurisdiction, there are those factors that help the mosquitoes to thrive. Number one, we have those stagnant waters. They are going to help those parasites to be infested there. So in such areas or swampy areas, we are going to get very more malaria parasites which can be able to transmit the infection. And that is it.
Okay.
Yeah.
And maybe you would just tell us about the prevention. How can we prevent being infected from malaria?
I think we can just skip that for us to make a diagnosis,
Okay.
treatment, then later we'll go for the prevention.
Okay, fine then. Maybe you would just maybe explain to us. I have come to your clinic and I've explained my symptoms. Maybe I have chills, I have fever, I have a headache, sometimes nausea, I'm vomiting. And now, as a clinical officer, in your medical wisdom, you've maybe thought that I might be having malaria. How are you going to determine that now and of course be sure that I have malaria?
Okay, good question or rather inquiry. Once a patient comes in my room, consultation room, he or she has explained the signs and symptoms. We also we have that impression. We say impression. An impression is you are making that because depending on the sign and symptom that the patient is telling you. So once I see that the signs and symptoms are more of malaria, then I will send you for a laboratory test. Most of the time there are two types of tests. Number one, we have a microscopy test whereby we use what we call a microscope. Then number two, we have a random diagnostic test. Random diagnostic test, these are just a kit whereby we withdraw your blood, we place on the kit, we place a buffer, then we wait for the results. For the first, we usually encourage for microscope. For microscope, using the microscope is very important because number one, it's going to give you the number of parasites for that patient. Number two, it is going to detect which Plasmodium species are you, is it responsible for that malaria in that patient. So for microscopy, we do two things. We have what we call a thick smear. So thick smear, this is whereby the laboratory technologists, or rather he or she prepares the slide. So on that slide, number one, he's going to see, to report which type of Plasmodium are we dealing with. Number two, he or she is going to report the number of parasite count per field. So that's all about the thick smear. The next smear is the thin smear. So the thin smear is only detecting the parasites. So it's not that way clear. Then for the random diagnostic test, which is also called the RDT, that one, we only see if it's positive or negative. It's just as the other test kits, like the HIV test kit. So you'll only see the 2 lines or the 1 line. So if the line is, if it's 1 line at control, it's negative. If it's 2 lines, both at the test and control, it's positive. So with that, it's not that way recommended, or rather, it's not that way very sure or reliable, because in early stages, the random diagnostic test might be negative, and the patient is really having the parasite. So we always encourage for the patient to do a microscopy test using the microscope.
Now, a couple of times I've gone to hospital myself, and then the lab technician or the clinical officer attending to me would tell me or say something about 200 rings, 300 rings. What does that mean when it comes to malaria?
Okay, thank you. That's what we call quantification of the parasite. So for per field, as detected by those medical laboratory technologists, they always read the malaria parasite in relation to the field, according to what he or she is seeing per 1 field of the microscope. So that's mostly about quantification of the parasites.
Does it mean that if I have maybe 50 rings, my malaria is not as severe as one who has 200 rings?
Yes, that's very important, because you can't. That's whereby now we also embrace, or we also detect quantification of whether this is severe or this is non-severe. So someone who is having almost 1,000 rings is having severe malaria, and we also have someone who is having either 2 rings. That's non-severe, depending also on the signs and symptoms.
So we're just going to take this short break, but when we come back, we are now going to determine the course of action after it has been determined that you're now suffering from malaria. Don't go anywhere.